Welcome back. Ahead of the elections next year, political parties have been highlighting their plans for Nigerians. The ruling All Progressives Congress APC recently released its own called Renewed Hope 2023 Action Plan for a Better Nigeria. While this document has been dissected in many quarters, today we take a look at the plans for vulnerable groups, especially in the area of healthcare, women and youth empowerment. Joining us on the program live from our studios in Abuja is the National Women's Leader of the party, Dr. Betaidu. A pleasure having you with us. And coincidentally, her forte is the health sector. She's also passionate about issues affecting women. Great to have you on the program.
Thank you for having me, and I'm really glad to be here with you today.
Now, you're privy to these elaborate plans, and there's a lot of talk about boosting the economy and turning things around for a better future. Tell us more about the APC's plans for the nation's healthcare sector.
I think the APC was very clear with its plans for healthcare in Nigeria. The Asiwaju Bola Ahmed Tinubu and Shetima Ticket have promised Nigerians that they would fast-track the journey to achieving universal health coverage in Nigeria. Remember, we have some issues that have before the health system. Of course, more importantly was the fact that we had to go through a pandemic which really exposed some of the shortcomings of the health sector. Some improvements have been made, but the government of Asiwaju Bola Ahmed Tinubu, when voted into power, would actually fast-track our movement to universal health coverage. A lot of things will receive special attention, from the amount that would be budgeted for healthcare, the provision, of course, he said it very clearly that certain things like the fuel subsidy and the rest of it will have to go. But these resources will be channeled back into something that will affect every single household in Nigeria. One of it is health, and the other one is education. He was also very clear when he discussed the issue of infrastructure, the health infrastructure, and how we need to upgrade them and even build specialist hospitals, bring enough manpower that can offer these services to Nigeria, which will reduce our medical tourism that we lose every day to several other countries. Of course, you hear that the number is over $3 billion lost every year from Nigeria to other countries. This has to be brought back to our country. He also made mention of being able to prepare ahead of time for the next public health emergency, whatever it is, whether it's COVID or it's Ebola or monkeypox or whatever it is, being able as a health system to prepare the system to face whatever emergencies that might come up. Several other aspects include the local manufacturing in our country, where we should be producing drugs that are used in Nigeria, vaccines that are used in Nigeria, rather than depending solely on importation from India, China, and Pakistan and other countries. So a lot of work is going to be done in the health sector, and there is indeed a renewed hope for the health sector in Nigeria under Asiwaju Bola Ahmed Tinubu and his running mate Kashim Shettima when elected as president and vice.
Now, still talking about the health sector, a major concern also is the brain drain and their agitations for remuneration. So what is in the works regarding this particular issue?
So there are different strategies which would be deployed, but what is most important is the fact that they pay as well as the environment in which they will work as medical professionals in the country would be greatly improved. His target is to see that Nigerians begin to look forward to returning to Nigeria to come and work. Whatever you've lent out, you come back to invest in it. Of course, we need to step up our level of manpower production. We had issues, or we've had scenarios where medical schools are churning out very little number of medical doctors that do not meet the World Health recommendation. Of course, it should be 1 to 400, but here we have over 1 to maybe 6,000 or even if not more at this point in time. We should be able to overcome that. We should give them the right remuneration. We should be able to provide the right environment for them to work and then provide other incentives. Beyond that, there have to be a deliberate act to send health workers into rural areas from the primary health care level all the way up. They should be given the right incentives to stay there and work. If you look at the spread of health workers in the country today, you will see that most health workers, they are either in urban areas, in Abuja, in Lagos, as compared to other local governments or even other states that are a bit rural and not necessarily very urban. So these are the disparities that the renewed hope agenda for healthcare intends to address. But beyond this, he has also said that as part of looking into the healthcare system, we would be going towards a mandatory health insurance scheme that would cover at least 40% of the population within the next 2 years. If 40% of the population is covered under the health insurance, definitely government can be able to subsidize for the rest of the population. That way people can have access to quality and affordable healthcare services wherever they are in Nigeria. So these are part of the things, building on basic healthcare provision fund, building on the structures that have been laid by President Muhammadu Buhari, the government of Tinubu and Shetima, by the grace of God, when voted into power, would do more to see that Nigerians can have access to healthcare. One very last and important point is the fact that women and children under 5 would have access to free healthcare services across the country, as well as some vulnerable groups that he has clearly stated in the action plan, by the grace of God, to be implemented from May 2023, when he is elected as president of Nigeria.
Now let's talk youth empowerment. There's a promise to create more jobs to reduce the numbers of the unemployed. How far-reaching will this be?
Oh, as much as possible. So there are different areas and different sectors, and in all of these sectors, young youths and, of course, women would be prioritized. He has said very clearly, in terms of employment, in terms of appointments, in terms of elective positions, young people would be given a lot of opportunities. Indeed, building on their expertise in technology, ICT, the energy sector, the entertainment sector, and the security apparatus, a lot of jobs will be created. Innovation technology startup hubs across the country, a lot of ICT expertise to build the capacity of young Nigerians to do wonders that would be exported out of our country and used all around the world. Of course, we know what it is for China. Of course, we know what it is for young people in the US, in China, where opportunities are given to them to use their own capacity to create apps, to create different forms of social media platforms that have been used, and it gives them a lot of income. All of this will become very practical in Nigeria. So it's a far-reaching point for the Tinubu Shetima action point. Young people will be given jobs, employment rates would go over the sky, and indeed, they would have a lot of build-up vocational skills and the skills to improve economy and also export our own expertise outside Nigeria.
The APC National Women's Leader, Dr. Betta Edu, a pleasure sharing your thoughts with us on the program.